Hi, my name is Jill. I am 21 years old and I've worked here at Florida Plastic Surgery and Med Spa in Sarasota, Florida for about a year. I am one of Dr. Hamwi's medical assistants, and one of my main roles in my job is to assist him in the operating room. Most commonly, I help him with our brachioplasties with arm liposuction. In April of 2024, I embarked on a weight loss journey, totaling a loss of 179 pounds. I was inspired to start losing weight by my mom, who got sick in July of 2023. She's diagnosed with stage 4 appendix cancer and went through many aggressive treatments in order to save her life. I saw that weight really impacted my family, both my mom's health and my dad's health, and I decided that I wanted to make a change. In addition to consultations, we do, I'd say, between 3 and 5 brachioplasties each week, and it's really amazing to see where our patients come from and how they came across Dr. Hamwi. They call him the goat of arms, and I'm really excited to have my arm sculpted by him too. When we do in-office consultations, one of my absolute favorite things is Dr. Hamwi will have the patient put their arm up and he'll push their arm back to show all the loose skin that he's gonna remove. Now, I don't have like a significant amount of volume since I've lost so much weight, but I'm excited, just seeing this and having him push my arm back in the mirror makes me really excited for the next couple weeks and to see what my arms are gonna look like after surgery. 10 weeks ago today, I sat in this same chair in this same dress before my brachioplasty, thinking about all the things that were ahead. Today, I am officially 7 weeks post-op, and I really couldn't be happier with how the last 7 weeks have gone and how well my arms look. You've gotten to follow my journey through a little bit of each week, the ups, the downs, the different scar therapies that we've used, and I'm here to break it all down for you and kind of talk about my experience over my healing journey, and really it's only the beginning from here. I'm physiologically healed, but my scar has a little ways to go, and I'm excited to continue to try different scar therapies that we offer here at Florida Plastic Surgery and Med Spa. Next, I wanted to talk a little bit about my surgery experience. So I know for patients considering an awake arm lift, it can be a little intimidating to be, awake during such a big procedure, but I want to tell you, it honestly went a lot easier than I was expecting. I know from personal experience, I help Dr. Hamwi in 2 to 4 of these each week. Our patients do particularly well. While some of them may be nervous, everyone really sails through the procedure, and by the end of it, they say, well, that wasn't that bad. I think my specific nerves were that I've seen the other side of things. So while all of our patients' eyes are covered during surgery, I know a little bit about what's happening behind the scenes and the different distraction techniques that we use. So I was a little nervous about being on the other side and having it done to me. I want to tell you that it was super easy. I felt really relaxed during the procedure. We listened to great music, and we talked about Dr. Hamwi's kids. We got to catch up a little bit. We don't always get to talk one-on-one with my coworkers, so surgery day was really great. Once I left the office, I went home for the night. I want to say I left here about noontime, 1 o'clock or so, and I went home and we watched some Sunday night football. I took a nap in the afternoon, had a good dinner, had a little sweet treat before bed, and I really just took it easy. That first night I was pretty pain-free. I could tell when the numbing medicine was wearing off, my arms got a little bit more sore, but nothing was ever really painful. It was really well controlled with the medication that I was given. During the day, I think the one moment that was like, I've really done this, was when I kind of got to take a peek at my arms. The little glimpse that I got, I definitely got emotional. You can see it in the second video. I got a little sad. They were happy tears, just thinking about how far I've come and how close to the finish line Dr. Hamwi has gotten me. I knew that moment was kind of, surgery's over. Now it's just about the recovery, and the last 7 weeks have been really great. As for the first couple weeks after surgery, there are a couple limitations that you kind of have to stick to. Now, your arms, they move. With the movement, some people get openings. I was fortunate, I didn't have any. And I think that's because I kept in mind all the time, like, I am freshly out of surgery, I need to take it a little slower. These first 6 weeks are kind of what determines what your scar is gonna look like forever. I think that my challenges and limitations for the first couple weeks after surgery, one of them was definitely driving. I didn't drive, I wanna say, for the first 4 or 5 days after surgery. And I found that it was easiest to grip the wheel, the steering wheel at the bottom or at the sides. Holding your hands like on top, 10 and 2, was a little bit difficult. It pulled a little bit in the armpit for those first couple weeks. So that was a little bit tricky. I worked my way back into driving. I started by just running up the street to the post office, going to grab a coffee, something like that. And then I eventually, around 8 days post-op, came back to the office for the first time. And my drive, I'd say, is about 30 to 45 minutes, depending on how the traffic is. I was totally fine by that time to get back to driving those longer distances. Another limitation that I had was showering. Now, a lot of our patients ask about like hygiene. Using the bathroom, totally fine. Brushing your teeth, that's totally fine. It's kind of the motion of getting your arms up above your head. I found that it was easiest to tilt my head to the side to wash my hair and to brush my hair because the Pico is a little bit limiting. It's kind of a nice reminder, and I think that was another one of my big challenges is remembering, I mean, I am young, I am kind of cruising through this recovery, but I do need to take it slow. So the Pico reminds you that you can't lift your arms too high in the air. So I had someone help me shower. We washed my hair in the sink for the first like 2 weeks. And then at that point, I was able to go back to doing it on my own. Again, tilting your head to the side is probably the easiest way to do it, as opposed to lifting your arms up to 90 degrees to do it. Same thing with round brushing my hair and blowing out my hair. I had someone else help me with that for the first couple weeks, and I just didn't worry about my hair too much during that time. After surgery, we put all of our patients in that negative pressure Pico dressing, and then we put a compression garment on top of that. Now the compression sleeves end probably about here. I'm a little bit taller, I have a little bit longer of arms, so they go down a different distance on each patient, but I'd say mine ended about here. And I only ended up wearing those for a couple days. I didn't end up having a lot of swelling after surgery, so I didn't wear the compression garment for too long. I only wore it for a couple days, and then at that point, it was kind of causing more harm than good. And Dr. Hamwi kind of acknowledges that this is a part of the healing journey. So sometimes it'll rub in different areas on patients, and I'd say 50% or so of our patients stop wearing the compression garment at some point during their healing journey. Mine just happened to be a little bit earlier. I only wore it for a couple days, and then our nurse Denasia saw how it was creating a little bit of an indentation down here, and she said, just disregard it, don't wear it. I thought that I was going to get back to it, but my swelling really never got that bad. The only discomfort that I'd say that I had was I could feel a little bit of soreness in my forearms. When we wear sterile gloves in the operating room, they go to, I'd say about here. So they cover our hand and some of our forearm. And it was the little compression that was happening in my forearm here that was a little bit sore throughout my forearm. Same thing if I would pull my sleeves up, wherever the end of my sleeve was, it was a little sore there. Aside from that, I didn't really have any issues. If I bang my elbow into things, it's sort of like hitting your funny bone. We were talking about it in the operating room the other day, and Angie, one of my coworkers, suggested, well, maybe it's because I have a little less padding on my elbow, which definitely makes sense. Now that I'm about 7 weeks post-op, my arms have really started to take shape and the swelling has gone down. It makes me so excited to get dressed in the morning. Now that I've had my arms done, I wear these scrub tops that are a little bit different than I was wearing before. I used to wear these short sleeve ones, and now I wear more of a sleeveless top. I'm wearing this jumpsuit, and then there's another one. They're more sleeveless, they're cut a little bit differently, something that I wouldn't have had the confidence to wear before, but it makes me excited to get dressed in the morning and try out these different things. When I'm not at work, I really enjoy wearing bodysuits now, something that I didn't feel super confident wearing before, but the bodysuit kind of sculpts to my arms, and you can see all the different sculpting that Dr. Hamwi has done and how he's really improved my arm shape, not only the lift, but the shape on the outside. I'm really looking forward to getting back into the Pilates studio. One of my bigger insecurities when I was working out was when we would push our arms out to the side. There are a couple different moves in Pilates where you're sitting facing the mirror and we'd extend our arms out to the side. There's this one video that the Pilates studio took and they posted it to their Instagram, and all I could see were what people call their bat wings hanging down. I'm excited to be able to wear these like baby tees or sort of sleeveless tops and not see that. I may have a scar, but the scar was definitely worth the trade for myself. And my advice to anyone who's hesitant about the scar is take like an orange or a red Sharpie and draw a line along your arm. For me, I did this for a couple days. I walked around with it and I didn't seem to notice it much. I thought that the scar would be well worth the trade to be able to look in the mirror and feel confident with my arms, with the outside of my arms, the way that they look when they're relaxed onto my side, the way that they look when they're out. Overall, he thinks about arms in totality, and I really loved the way that he sculpted mine. My message to others who are considering an awake arm lift is to do it. Have that consultation. Dr. Hamwi is great. He will walk you through everything, and he's very honest about where he thinks that he can bring you. Now, as I mentioned in the original video that we took here at the other sit-down video, when patients are in the office, Dr. Hamwi will kind of push the skin back. Now, I don't have any skin that goes back anymore, but he'll push the skin back and you can really start to see your arms take shape. That was really a big eye-opener for me, and seeing him lift that showed me what the potential was of having an arm lift. Push your arm back in the mirror and say, like, is that worth the scar to me? How often does it really bother you? Those are all kind of things that I took into consideration before moving forward with my arm lift. Now, I think a lot of our arm lift patients will tell you that this is something that they've been considering for so many years, and it's something that they're really disappointed that they haven't done sooner. And not disappointed, but like they wish they had done it sooner. They wish they had done it when they were my age or 10 years ago or something like that. If it's something holding you back, make the consultation, take the first step, talk to Dr. Hamwi. He really is the greatest at arms. As I sit here 10 weeks after we did this original interview, I think back on my journey over the last 7 weeks of my post-op experience. Dr. Hamwi has been with me through every step of the journey, and I really couldn't ask for a better boss, a better mentor on my road to med school, and a better surgeon. He truly cares about all of his patients. He'll call and text whenever you need advice or whenever you have a question. He is always there for his patients. So huge shout out to Dr. Hamwi. Thank you so much for everything you've done. And a big shout out to the rest of the Florida Plastic Surgery team. Juliana for helping me schedule my surgery and for documenting the whole journey. And then Diana, who helped me in the procedure. She kept me calm throughout the whole day, did the tapping, we got to talk. Jenna and Denasia for helping during the post-op experience, and Sia for helping on surgery day as well. The whole Florida Plastic Surgery team has been great, and I'm confident that you'll have the same experience as I did if you choose to have an awake arm lift with us. Schedule a consultation. It's one of the best things I've ever done.